Good afternoon. Welcome to the PEDro Podcast with Mike and the boys. I'm your host, Mike. Today we'll be discussing a moderately valid article with a score of 5 out of 10 on our PEDro scale. Adam, go ahead and give us a quick 30-second summary of our article.
Yeah, thank you, Mike. So this article looked at patients who suffered from a stroke and were able to ambulate 3 months after the stroke. And they're basically divided into two groups. One group received foot drop stimulation, or FDS, and the other group received AFO treatments with TENS unit. The findings of the study was after 30 weeks of treatments, both groups had significant improvements in gait speed, both at a comfortable pace and a fast pace. And it was noted that there was lower compliance with the AFOs and a higher satisfaction with the FDS.
Great. Thanks. Now that we kind of know what we're testing, Andrew, go ahead and take it away with our concealed allocation and blind participants categories.
Yeah, so a big problem that I had was that allocation was not concealed in this clinical trial. Basically, what this means is that the person in charge of the inclusion and exclusion criteria for this patient population knew which groups the patients were going to go to. This could lead to selection bias, which means that this person or group of people can essentially look for patients who have a higher prognosis, who know that they're going to perform better with certain interventions. So a way to fix this flaw, and the article did not state this, is if you could have this person blinded to what the interventions are going to be, and maybe also have this person not be one of the therapists working with the patient population, you would eliminate this bias.
Nicely done. CJ, you're on the hot seat. What did you think of the intention to treat category?
So my big thing was they had 8 dose match therapy sessions where they were taught how to use their respective devices. We're taught a little bit of gait training, and we're also given individualized home exercise programs. But about 50% of those with the AFOs were not compliant with their home exercise programs, and those were included in the final breakdown. So I would start by just eliminating the home exercise program and having the patients complete all the interventions and testing in clinic.
And RJ, go ahead and take us home with the blind assessors category.
Yes, these blind assessors could clearly see which group's data they were analyzing, as they were just labeled the AFO or the FDS group, and that could lead to unconscious or intentional bias. And so to fix it, I would randomly assign the groups either Group A or Group B, so that when the investigator was analyzing the data, they were blinded as to which group's data they were analyzing.
Thank you, RJ.